सी डिटेल्स होती हैं वो आप मिस ना कर दें. Just giving an introduction to those who may not know me, I am Professor Farida Amin, and as you can see that I am a fellow of College of Physicians and Surgeons of Pakistan, and I'm currently the Dean of Family Medicine at CPSP. I did my MRCGP International in 2010 maybe, yeah, 2009-10. And I have the privilege of securing the highest marks in the OSCE till date, which is like 14-15 years now. Besides that, I have been teaching family medicine courses and taking preparatory sessions for talks for those who are appearing for MCPS through the experience pathway. और इसी तरीके से MRCGP तो mostly लोग experience pathway से ही, बल्कि majority, बल्कि I would say 100% लोग जो है वो उससे pathway से ले रहे होते हैं, experience pathway से. तो I'm sure कि all of you need a lot of help. क्योंकि MRCGP International, let me tell you, it is not an easy exam to pass. It is pretty, I would say, standardized. It is very detailed. और इसमें टाइम मैनेजमेंट के इश्यूज होते हैं. इसमें it is difficult for you to speak in English. That is I think that's the greatest challenge people have, because they don't have a practice of sort of giving consultations in English. So you get stuck in thinking in Urdu and then translating it in English, and then finishing your case on time as well. So I would request all of you, those of you who have just joined in, to please switch on your videos. Dr. Tawheed, kindly video on kariye. Dr. Rabia, Dr. Shahid, Dr. Mudassir ki on hai. Okay, Faiqa, Sarfaraz.
You light gay, yeah, I will appear like a ghost.
Ma'am.
That's okay. Walaikum assalam. Kavita, good to see you. And please, all of you, switch on your video so that I can see you all, and it will be better for me to interact with you and know who are you. So please switch on your videos. I'm going to give you an introduction to the MRCGP OSCE exam so that you have some idea what to expect in the exam. And then we're going to just today, because it's just an orientation session, I would just like to show a demo of how this class is going to run, how are we going to practice, all of us together. इसमें जो practice तो देखिए आप लोग आपस में भी कर सकते हैं ना. You can make groups among yourselves, and besides this, these sessions which we are going to have twice or thrice a week, even besides this, आप लोग practice अपनी continue कर सकते हैं. In between you could have your own Zoom practices, और उसके लिए हम आपको जो है वो facilitate करेंगी. महक can make Zoom IDs for you, and she can help you facilitate it. ठीक है. So ये आप लोग आपस में, चाहे आप लोग कराची में रहते हो या आप लोग जो है वो कराची से बाहर रहते हो, but we can do this for you. Kindly if you can just switch on your videos but mute yourself, क्योंकि कभी कभी क्या हो रहा होता है कि घरेलू मसले भी जो है वो वरना सारे लोगों को जो है वो सुनाई दे जाते हैं. तो वीडियोस ऑन रखिए और ऑडियोज जो है ना वो अपनी ऑफ रखिए. ठीक है. So mute yourself but switch on your videos please, so that you're attentive and you're there, and I can actually recognize with your faces that because इसमें OSCE में ना talks और OSCE का मैं आप लोगों को फर्क बताऊंगी, because I'm sure all of you or maybe majority of you have passed your MCPS. कोई है ऐसा जिसने who has not passed their MCPS exam, and is there somebody who doesn't understand Urdu, because certain people may be joining from Saudi as well. So does everybody understand Urdu? I'm going to try to keep my medium of delivery in English, most of it, because if I start speaking in Urdu, then you're not going to get a practice of practicing in English, right? So you have to start sort of thinking consultation in English so that you come up with the right things to say when you are with your patients and when you are in an examination setting. So OSCE is objective structured clinical exam. How is it different from talks, right? So we have 14 stations, and it's almost like the station sort of structure is almost like talks. It's like, you go from one station to the other to the other. The good thing about OSCE is, please mute yourselves, girls and boys and men and women and elderlies, whoever. So please mute yourself, switch on your videos and mute yourself, right? So in OSCE exam, you would have at least 4 to 5 rest stations. That is different from talks, in which mostly there are no rest stations. Usually, you have all of active stations, right? And all these stations, even in OSCE, okay, so Mehek, there are 2 people who have not even switched on their audios. Please, you need to tell them how to switch on their audios. Dr. Farouk's audio is not on. Dr. Rushna's audio is not on, although her video is on. So Mehek, please be very vigilant and active in letting the people know how to switch on their videos and their audios as well, because, they will not be hearing me as well. So you have at least 14 stations, and then you have certain rest stations as well. So you have to be very prepared to go through those 14 stations at once, but in between you will have 10 minutes of rest stations. So you can also use the washroom, or you can just hydrate yourself or whatever, right? So you would have at least 30 minutes in between on rest stations, right? So what happens at each station? At each station, now this is different from talks, right? In talks, you do not have time to read the instructions. In OSCE, you have 1 minute to read the instruction, right? And somebody is going to say that you have 1 minute to read the instructions, right? So that is what they're going to announce. So you know that you're now reading the instructions, you're outside the station, the candidate information sheet is outside the station, and you are reading the instructions for 1 minute, right? And what would the instruction say? So the instruction, for example, says a 50 years old male has presented with a problem. Take a history, perform a focused examination, and manage the patient, right? So just keep that in your mind. Now, this candidate information sheet will also be there in the table inside the room. So once you enter the room, so again, that person will announce, enter, right? Enter. So that means your time starts now, right? So you're going to enter the room, and in the room, you're going to have another candidate information sheet on the table, right? So you can go back and read the instructions again in case you've forgotten, although you should not be forgetting it. But then, if you want to come back to it, you can. So then you start your case. You don't need to ask the permission of the examiner. You don't need to do anything. You just need to go get into the room and start this case. Hello. For example, if the name is written or name is not written. Hello, I am Dr. Farida. May I know your name, please? Okay, so my name is whatever. How can I help you? So your consultation should start with saying, how can I help you? Do you have any other sort of ways of asking this? How can I help you, ke alawa?
May I know your illness? What brings you today?
What brings you here today? That's right. Or koi tarika? Any other sentence? So, you need to keep these sentences in your mind.
From
What? Any other sentences you usually use while taking a history, while starting a conversation? What brings you here today? How can I help you? These are 2 I would use. Maybe if you have any other, let me know, and I'll tell you if that's the right thing to say, right? So, and then when the patient tells you, doctor, I have headache, for example. So what should be your next question? What should be your next question?
Tell me more about your headache.
Yes, that's the right thing to say. Okay, tell me more about it. So you start with open-ended question. The first question should be, how can I help you? The second question invariably should be, tell me more. Okay? Uske baad, you're going to come to close-ended questions like, do you have fever? Do you have dizziness? Do you have any weight loss? Have you lost any weight? Whatever. So you can come up with that specific questions, because mostly the patient would tell you whatever they want to tell you in what brings you here today. And the second question is, tell me more, right? So they would have told you a lot of information in those two questions. Any remaining information you might ask after that. Is that clear to all of you? Sab logon ko samajh aa rahi hai ye baat? I can see 33 participants here, and I can see that most of you have kept your videos off. Please don't do that. Each one of you would have to practice, okay? If you don't gather the courage to practice in these preparatory sessions, you will not be able to pick up and practice in any other session ever, right? So you have to switch on your videos, mute yourself, please mute yourself, but just keep your video switched on, right?
Well, ma'am, there is one question.
Yes.
I'm Dr. West. So, once we ask open-ended question, okay, tell me more about your headache or anything. The patient is presenting with the complaint. So, do we need to ask जैसे हम talks में करते थे कि अपनी बीमारी के मतलब कुछ बताइए, मजीद कुछ बताइए. तो यहाँ पे कुछ और open-ended एक और दफा पूछने की जरूरत है?
No.
Okay,
one what brings you here today, and one more open-ended. Tell me more.
Okay.
Now, if you
Okay,
keep on asking, tell me more, tell me more, tell me more, these SPs or simulated patients कहते हैं ना इसको, SPs or simulated patients who are not actual patients, but they know their cases. These SPs are very smart. These SPs are not like the SPs you faced in TOEFS exam. These SPs are pretty smart, right? They're going to say, doctor, what do you want to know? Right? So you will be stuck there. They're not going to give you any more information. Whatever they've given, they've already given to you. Unless you now start asking specific questions, they're not going to give you any more information. Right, Avais?
Yes, ma'am. Thank you so very much.
Okay, so take a history, perform a focused examination, and manage the patient. Okay, up now. So 1 minute to read the instructions, 10 more minutes. That means 11 minutes, right? So 1 minute to read the instructions, outside room, you get inside, you have 10 more minutes. There is a warning call at 8 minutes, wherein the person who's announcing would say 2 minutes left, right? So they're going to be very clear about their instructions. They're going to tell you that 2 minutes left. Now, in the last 2 minutes, what do you need to do? That is what basically determines your fate, whether you're going to pass or whether you're going to fail this station. So if you feel that in the last 2 minutes, you haven't completed your examination, just leave the examination there and then. Do not keep on examining for the last 2 minutes because you have not managed him yet. So start managing. If you're good at it, then you can, while you examine, you can start, management as well. Or you can just ask the patient to come back and then start managing. So you're going to maybe lose maybe some points on not examining completely, but at least you're not going to get a 0 on management, right? So you have to be careful that when the 2 minutes announcement is made, you have to come to management. Absolutely, you have to manage the case, right? There and then. And as the bell rings, 10 minutes, right? There's going to be a bell which is going to ring, and then the announcer would say, move, right? And you have to move. So Dr. Ghazala does not have a voice in her Zoom. Please, Mehek, tell her how to switch on the audio, please, because she has probably not switched on the audio. Mehek, you need to please educate them. There's so many people who might not have attended any Zoom session, and I don't want them missing out on this very, very important information. Please let them know that they need to switch on their audios to be able to hear me. Okay, so at 10 minutes, you're just going to leave the station. Right? Is that clear? Ab tak jo bhi maine bataya, is it very clear to all of you? Please try to communicate in English. Please try, because the thing is, I know, we don't, it's not our basic language, but you have to just keep on trying, right? The more you talk in English, in fact, I would say till, you have your exam in March, even at home, start talking in English. Talk to your children in English, talk to your husband in English, talk to your parents in English. whatever you can do to be fluent in English. In fact, if you get a patient who can communicate in English, then you also communicate in English. Try to start doing those, practicing those stations on those patients who can speak in English, right? So please, continue to practice in English. That is very important. I think a lot of people would lose on a lot of time trying to translate things into their mind, right? So start practicing from now. Okay. So equipment, what do you need to take with you? So MRCGP exams, in the MRCGP exam, you would have all the equipments in the station. You do not need to take anything with you, be it a torch, be it blood pressure machine, nothing at all. What you could take is only your own stethoscope. Okay, you can keep a torch in your your pocket, something, but you don't need to take any thing which you can keep on forgetting at different stations, because it gives you a lot of anxiety. You've taken a hammer with you, it's there, now you've examined, and now you've forgotten your hammer in the last station. It's going to keep on bothering you. Just keep a stethoscope with you and don't lose your stethoscope anywhere, right? Other than that, nothing is required. It's better not to take anything, otherwise you're going to keep on sort of because you're nervous, right? So you're going to keep on forgetting it on stations, and then you're going to keep on worrying that, I've forgotten it on that station and I may need it now, right? Which you may not need. Please turn on your videos. As Mehak is saying, I want to see your beautiful faces, please. So OSCE content mein hota kya hai? What do you expect in each of these stations? In every station, whatever it is, you are going to be doing taking a history, performing good consultation skill methods. You're either going to be examining, so examination is not required in all the stations. It is there in at least out of 14 stations. It may be there in around 5 stations maybe. In rest of the stations, you are expected to manage and counsel. So either your counseling is being assessed or your physical examination skill is being assessed. History is being assessed on each of the station. Consultation skills are being assessed on each of the station, and on every station, your management skills are being assessed. On some stations, there would be examination skills, and on other stations, there would be counseling skills. Is that clear? Does everybody understand it?
Yes, ma'am.
Yes, ma'am.
What about the
Yes,
others?
ma'am,
Dr.
we are getting
Tawqir,
it.
आपका तो
जी।
एग्जाम भी नहीं है, आप तो बेगानी शादी में जो है वो आए हुए so आपका तो एग्जाम भी नहीं है. जिनका एग्जाम है, I want them
I'm
to
going
tell
to
me.
dance
Yes, ma'am,
in an
clear.
alien's marriage.
हाँ, बिल्कुल ऐसे ही है. जी जी बेटा, कौन बोल रहा था? कोई और सवाल है आप लोगों के अभी
Yeah.
तक? Any
I
question?
have a question. Maybe you tell it later on, but I just want to ask it right now. How
हाँ.
many stations we are supposed to pass? I mean, how do you pass?
ऐसा नहीं होता है. ऐसे देखिए, MRCGP में ना there's no particular कोई कट ऑफ्स नहीं पहले से आप लोगों को दिए जाते कि इस कट ऑफ पे आप पास होंगे. It all depends on that day and how all the stations have worked, and there's so many other things to it. Please do not unmute yourself if you are not talking.
No, my question is that there are 14 stations. So suppose I fail 4 stations. So what is the likelihood that I will pass?
You will fail, sir.
14 out of 4 में अगर आप fail हैं, there's a 50-50% chance that you would pass. कितने बुरे फेल है ना, ये भी फर्क पड़ता है. It's not like only failing, but कितनी बुरी तरीके से फेल किया है. So there's so many things on the MRCGP की marking is complicated. It's not simple. It is not as simple as you have to pass these many cases. Yeah, you have to sort of, this is the cutoff of the total marks. ऐसा नहीं है.
Excuse me, ma'am.
जी.
Hello.
जी.
Hi, ma'am. This is Dr. Riaz.
जी, Dr. Riaz.
मैम मुझे मालूम करना था, is there any negative marking in OSCE? अगर हम ज्यादा बता देते हैं या कुछ गलत बता देते हैं?
Yes, thank you for saying that. That is a very important question and I had completely forgotten about it. मैं भी assessment पे वैसे आने वाली थी, but there is negative marking in OSCE. There is no negative marking in TOEFL, but there is a negative marking in OSCE. अगर if you tell more than you're being asked, or if you just give information which is overwhelming, there is negative marking. If you say things which you should not be saying, you'll be negative marked. If you do things which you should not be doing, you will be negatively marked, right? So there is negative marking. For example, on a case which is like maybe a pneumonia, right? It's a simple pneumonia without any complication, and you refer the patient to the pulmonologist. You're going to be negatively marked, right? You might fail this station if you refer the patient inappropriately. So there is negative marking in OSCE. Isliye, it is very challenging. Not only I by shy tie nahi chalegi, balki you have to be competent, you should have the knowledge as well as you need to have that skill. Consultation skills bhi zaruri hai, examination skills bhi अच्छे होने चाहिए. You should be able to speak in English, you should be able to counsel in English, you should know your stuff, and then you should not be over smart, right? So
Madam,
that's all important. G.
Madam, I just want to ask if you mistakenly use a word or two, like we are not very fluent in English, and you mistakenly use words of Urdu or like this. How badly affect?
If you are using words of Urdu, like, people would say inshallah, we sometimes use henna, it's okay. It's okay. If because, if your exam is in Karachi, you're expecting that the SPs can speak in Urdu and can understand Urdu. But let me tell you, the examiners do not understand Urdu, because there's so many examiners who are from Sri Lanka who have no idea about Urdu. Even, the Indian examiners, a lot of them do not understand Urdu. So if you're saying things in Urdu, they will not understand. So you will not be marked. As simple as that, right? So you have to, sort of push yourself that you have to speak in English, and it should be fluent enough so that you're able to counsel and manage the patient. History taking, you can manage, right? But what happens is that when you're not very fluent in English, you cannot counsel appropriately. So I'm going to tell you the tips, the tips and sort of tricks of how to go about it. How do you prepare for your OSCE? You refresh your examination skills, you revise common topics, you make your mind as a GP, you be confident about what you know, and you don't be afraid of what you don't know, right? You need to practice and observe with time management and in English. So you need to practice among yourselves also. Ek aur cheez which is absolutely important in OSCE, which is not very important in talks, is consultation skills, providing person-centered care. And I think this is the most tricky part of OSCE. For Pakistanis who have not been trained in medical ethics, who have not been trained in consultation skills as an undergrad student, I think this becomes the most challenging. And a lot of doctors, a lot of GPs from Pakistan, and even, from other South Asian countries would fail just because their consultation is doctor-centered. Their consultation, they have all the knowledge, they have all the skills, even their examination skills are okay, their knowledge is fine, but they fail because they're too doctor-centered, right? They're speaking too much, which they're saying things which they should not be saying. They are being judgmental. They are not listening to their patients. They just have a stereotypical sort of, they have a checklist in their mind, which they are trying to tick, like we do in talks. Ye bol diya, ye puch liya, ye puch liya, ye. In OSCE, you have to behave like a very confident general practitioner who has been practicing day in and day out. So the examiner picks up that this GP has not been practicing, because the way he is communicating with the patient is all fake. So a fake approach to the patient can fail you, right? So Afshin is asking, when will the hands-on practice be? Okay, so Afshin, we're going to give you 2 Sundays where the hands-on practice will be. And even if you're unable to travel, it will be online plus on-site. So even if you miss it by coming here, you're going to be able to take it, as in online. The other thing is that if there are a lot of people from outside, what we could do is that we could arrange for a Saturday, Sunday. So the two face-to-face session can be on a weekend, which is a Saturday and a Sunday. So we can make arrangements like that as well, right? I want most of you to be attending those face-to-face sessions, because that is what, where you practice your clinical skills. You get sort of a very good flow while, having your practicing it the way it should be. So this time, we had this TOEFL preparatory course on a Sunday, and everybody got a chance to practice almost all the systems, in fact, all the systems. And Alhamdulillah, there was 100% result in TOEFL. But OSCE is very tricky. Let me tell you, it is challenging. I know not all of you would pass, but then at least you would know how to pass, right? You may, if you don't practice, it will be difficult for you to pass, but then you would know what to do to pass. So I'm going to try my best to bring you there. And that is how the course would help you. We would be practicing, and, some people would be practicing, some people would be observing more than 50 cases relevant to primary care. And of course, these 50 cases, more are very likely to, you would be able to sort of come across them even in the exam setting, because these are just, common primary care cases, which are there in TOEFL, which are there in OSCE, in any family medicine exam you would come your way. Sarvat has raised her hand. If you can unmute her, and Sarvat, you can speak up, please.
Assalamu alaikum, ma'am.
Yes, Sarvat.
I'm from Riyadh, KSA. My first question is that, is it necessary to clear each and every part? First part is consultation, communication skill, then data gathering, then examination, and then management. We have to pass in each and every part. And secondly, my question is that, as we are abroad, we could not come to hands-on, attend the hands-on. So is it possible that the end of the February or last week of February, you can arrange 2 days for us? Because we are a lot of colleagues here, and we want to attend at least 2-3 days hands-on. So what will be arrangement for us living abroad? Because my friends are living in Oman also, in Kuwait also.
Yeah.
So
I'll try, Sarvat. We are going to try our best, but see, if you have a lot of people who are taking this course, then it is difficult to be able to comply to each one's demands. But we're going to try to sort of be flexible and accommodate most of you. So yes, that's right. If it's in the end of Feb, then basically a lot of you would be here. But then we need to know prior to that how many of you would be able to attend in person, right? So we can have it on a Saturday, Sunday in the last week of Feb, but then you all need to tell us if you would be here.
Yes,
okay.
ma'am. Hello, ma'am. I'm Afshin. I would
Yes.
like to ask you that if we are coming in the last week of February, like you told that on Saturday, Sunday, it would be very appropriate. Yani we can attend at that time.
Yeah, we will try that. Absolutely. I agree with you. See, I am here to help you, right? And I want most of you to pass. I am somebody who wants postgraduate family medicine to be there in Pakistan and elsewhere and throughout the world. And I mean, it's my wish that each one of you should pass. And I'm going to try my level best to make that happen, right? In a positive way, not in a negative way, of course, in a very positive way, so that not only do you learn how to pass an exam or an OSCE exam from this preparatory course, but you also become better doctors. Dr. Taqi, are you here?
Assalamu alaikum, ma'am.
Yes, Sadia. Do you have a question?
Ma'am, I am Dr. Sadia. Yeah, ma'am. Please tell me the date of online preparation classes for Karachi students.
It will be for everyone. So we're going to do the online with everybody on the same days. Regarding, okay, so Dr. Usman also has a question. Could we get videos? Yes, you're going to get videos. Of course, it's going to be online and on-site as well. So, with on-site, आप लोग online भी देख रहे होंगे. Online भी आप लोग observe कर रहे होंगे. Yes, Dr. Usman, you wanted to ask something. Dr. Sadia, so आप ये पूछ रही थी कि कौन से days होंगे? Yes, so Wednesday and Friday. Is that right, Mehak? Am I right? It would be a Wednesday and a Friday, 5 to 6:30 p.m. So 5 to 6:30, 6:45 p.m. On a Wednesday and a Friday. This is going to start from January, and we're going to continue till end of Feb. So, the cases would keep on coming. Right,
Ma'am, sorry, ma'am. If you
just 1 week
change
prior to the
time
exam, I hope that all of you would be well prepared to, sort of consult any type of a case from any systems. Ji, koi kuch bol raha tha?
Ma'am,
Farooq,
will you
Dr.
please
Farooq, you want to
a
ask
little
something?
bit change the time, because 5 o'clock at Pakistan means 3 o'clock. So duty finished at 4 o'clock. We reached at home at 4:30. So would it be possible to start at 6 o'clock, because at 6 o'clock means he will be here at 4 o'clock. 2 hours difference between Pakistan time. It will be not possible.
So what we could do is that we could also have it from, let's say, if it suits everybody. See, so I cannot just continue to change the timings according to one person or two person or four people, but the other option could be from 9 p.m. till 11 p.m.
Yes, this is best
No,
time.
ma'am, we have evenings. Ma'am, I have evening from 7
That's
p.m.
what I'm telling you. See, so that's the problem. Half of you will say, no, that doesn't.
Previous time in 5 to 7 is fine, ma'am. I think
Okay,
it
so
would be
either
easier to
5
work
to
in
7.
between time.
I think
All right,
9
what we
to
could
11
do is,
is
hello. Stop. Okay, so what we could do is that we could just arrange a poll on your group. So on the group, you all are on that WhatsApp group, which Mehak must have made. So Mehak, could you just put a poll there and let them see the results? Whatever the majority says, I'm going to do that. Right? I see that a lot of people want 9 to 11. Some of you are saying 5 to 7. I just want to know the poll, and we're going to go with democracy. Right? Okay, Rabia, you want to ask something? Please ask. Mehak, share the WhatsApp link with everybody, please, so that they can join the WhatsApp group.
Assalamu alaikum.
Yes.
Ma'am, I wanted to ask that regarding counseling, are we supposed to counsel related to the local
hello. Mute करिए अपने आप को, girls and boys. Yes. जी. हाँ, आपने कहा काउंसलिंग में क्या करेंगे? काउंसलिंग के बारे में
Are we supposed to, like for the management part, there are some things that are locally related. For example, like malaria, some drugs are resistant in our area, endemic in our area, things like that. So are we supposed to counsel related to our local scenarios, or it's the standard medicines which we or management we need to counsel regarding?
It's just okay, that this is not something which is going to bother you. For example, malaria, you can go along with the WHO guidelines. That should be okay. We know, I mean, we would have options. For example, if we have a checklist or we have an assessment sheet, we would have either of artemether or chloroquine in case if it's a Vivax. And if it's a falciparum one, then of course we would have artemether. So it's okay. The examiners are well versed. They know what they're asking for, and it's okay. These little things wouldn't change the fate of your exam result, right?
Okay, ma'am. Thank you.
Ma'am, if we forget the dose, so what we can prescribe the medicine only. Is that okay?
Yeah, if you at that point in time you can't remember the dose, then you can just tell them the medicine name, and that's fine. If they ask you, doctor, what is the dose, then that's different. If they're asking that, then probably the examiner wants to know. So in that case, you will be in trouble. You can say that I'll just check it on my pharma guide, and I'm going to let you know. Right, so even that's
Ma'am,
okay.
I haven't booked my exam yet. I just wanted to know what the time duration do you suggest for preparation if once we book the exam? What should we target?
I think it all depends on how comfortable you are, how much is your knowledge, how much is your practice. If you've been practicing day in and day out, if you've passed your theory exam, then I don't know why you should be stopping yourself from taking the OSCE exam. For the theory, if you're asking for the theory exam, then again it depends how much of already knowledge you have, so if you're already practicing, then it might take you maybe 3 to 4 months to practice. Maybe if you are totally out of touch, then it might take you 6 months to practice MCQs and come back into sort of the updates. So it all depends, what is your personal level of knowledge and understanding.
And once we've
Ma'am,
cleared the
I
theory
want to
part,
ask that what is the
what is the
passing
difference
percentage for the exam?
No, I've already answered that. That doesn't matter. That just doesn't matter. I mean, in my whole, I'm just telling you, in my whole career, I've at least passed 7, 8 exams, and never have I ever asked or thought about how much is the passing percent. Don't think of just passing. Think of excellence, right? Do the best, right? Think I'm going to pass all the 14 stations. I'm not going to fail any of the stations. And that's where your success will lie. Don't think मैंने 5 पास कर लेने, 5 मैंने छोड़ दे. आपने जब आपके पास जब पेशेंट आता है ना, तो पेशेंट को आप ये नहीं कह सकते ये तो मैंने ऑप्शन में छोड़ दिया था. You just have to go through each and every important case of primary care. You just need to understand that you need to pass all the cases to be a good doctor, beta. So don't think about it. Percentage kitni hai, kitte station mujhe pass karne. It's going to keep on worrying you. You're going to keep on being anxious of how many I've passed. एक स्टेशन से पास करके दूसरे वाले स्टेशन पे आइए, भूल जाइए उसको. वहां पर मैंने पास किया है, फेल किया है, that doesn't matter. The other stations matter now. So remember that always.
Yeah, hi, ma'am.
Dr. Usman. Yes. Okay, Dr. Usman, I remember. Yeah, hands-on. We will have videos. Videos तो आपको आ ही जाएंगी ना. तो if you're taking the course, तो फिर videos तो आपको मिल जाएंगी. जो hands-on practice की है, वो तो आपको सारी, वैसे भी जो सारी examination skills की videos है, वो तो आप लोग के साथ वैसे ही share कर देंगे. वो तो open YouTube पे पड़ी हुई है मेरी videos, तो वो तो आप लोग से वैसे ही share हो जाएंगी. लेकिन जो focused examination हम करेंगे ना, case related, वो जब हम on site करेंगे तो वो सारी वीडियोस आप तक पहुंच जाएगी. और सेकेंडली, हम जितने भी केसेस कवर करेंगे ऑनलाइन ना, उसमें भी हम फोकस्ड एग्जामिनेशन को वर्बली बोलते रहेंगे कि इस वाले केस में क्या क्या चीजें आप एग्जामिन करोगे. दिस इज व्हाट वी आर गोइंग टू कीप ऑन रिवाइजिंग. फिर जब हैंड्स ऑन होगा तो आप वो कर सकोगे. जो लोग नहीं भी आ सकते, वो घर पे अपने किसी भी खानदान के बंदे को पकड़ के कर सकते हो, ठीक है ना. तो फोकस्ड एग्जामिनेशन टेक्निक पता होनी चाहिए. देखो, जब आप लोग ऑनलाइन एग्जामिनेशन स्किल्स अटेंड करते हो ना, व्हाट हैपेंस इज लोग ट्यूनिंग फोक को भी उल्टा लगाते हैं. I've seen in this talks कि जिन्होंने ऑनलाइन अटेंड किया था, वो ट्यूनिंग फोक के, वो फोक से जो है वो टच कर रहे थे लेग्स को, जबकि उसकी स्टिक से करना चाहिए था. सो दिस इज व्हाट हैपेंस, और इसका मतलब ये कि आपने कभी प्रैक्टिस की नहीं है. आप अंडरग्रेड भी शायद आपको पास किए हुए बहुत साल हो गए, आप बिल्कुल ही भूल गए हो ना. तो अगर आपके ये वाले हालात है ना, तो प्लीज ट्राई करो कि ऑन साइट आके अटेंड कर लो. इतने बुरे हालात है ना, तो ऑन साइट अटेंड कर लो. इससे जरा हालात बेहतर है ना, तो इट इज ओके. यू विल बी एबल टू सॉर्ट ऑफ गो अराउंड इट. Dr. Uwais को जो है वो he wants to just do a case with me, so it's fine. If you can switch on your video jaldi se, Uwais.
Yes, ma'am, it's fine, no issue.
Thank you. Yes, ma'am.
Yeah, thank you. Keep all of you should be mute, ठीक है? Everybody should be mute. Dr. Uwais, where have I seen you? Train the trainers. Train the trainers.
Train the trainers maybe, and maybe on the opening ceremony of APNA at Pindi.
Okay. वो वाला मुझे याद नहीं है. Train the trainers याद है मुझे.
Okay, yes.
Okay, that's great. Good to have you. And okay.
Well.
Okay. So who's timing? Kavita, you going to time? You're just going to say start. 8 minutes पे आपने कहना है 2 minutes left, and then 10 minutes पे आपने कहना है move. ठीक है?
Okay, ma'am. Okay.
चले, start बोलेंगी आप. Okay, should we start, Kavita?
Start.
Yes.
Hello, I'm Dr. Aves. How can I help you? May I know your name, please?
Doctor, I'm Mrs. Aslam, and basically, you know, I have swelling in my feet.
Okay. Anything else you want to add?
Doctor, I have swelling in my feet now going on for the last 2 months, and I'm worried.
Okay. Okay. So in order to know more about your disease, so I need to ask you a few more questions. Is it okay with you?
Sure, doctor.
Okay. So can you please tell me like for how long you are suffering from this illness? This
Uh,
swelling in-
Doctor, as I said, I have it for the last 2 months now.
Okay. Okay. And do you okay? Do you have shortness of breath as well?
No, doctor, I don't have any shortness of breath.
Okay, okay. And when do you observe it? I mean, when it comes on the at the time of the day. I mean, when you hang your legs more, then you get this type of swelling.
Doctor, it's throughout the day, but I think I feel it's more in the evening.
Okay. So, do you have any? Do you have diabetes?
No, doctor, I don't have diabetes.
Okay. And do you have hypertension?
Yes, doctor, I have high blood pressure, you know, for the last 6, 7 years now.
Okay. So, are you taking any medicine for that?
Yes, doctor, these are the medications I'm taking. So the medications say that she's taking losartan, 50 milligrams, and she's
Okay.
taking amlodipine, 10 milligrams.
Okay. Okay. And how about your blood pressure levels? Do you get them checked? I mean, are they good?
Yes, doctor, blood pressures are controlled. Even the nurse told me today that it's fine.
Okay. And okay, so have you ever observed, I mean, you are, I mean, losing some weight or in the recent time?
No, doctor, I am not losing any weight.
Okay. 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 So if you don't mind, can I ask you some personal question, please?
Sure, doctor.
Okay. Do you smoke?
No, doctor, I don't smoke.
Okay. And do you drink?
No, doctor, I don't drink.
Okay. So any recreational drug you've used
No, no,
in the
doctor, I'm
recent
not
times?
using any recreational drug.
That's good. That's good. Okay. So, does anybody in your family has this kind of illness?
Uh, Doctor, like swelling in the feet? No, I
Yes.
don't think so.
Okay. Okay. So, do you feel any pain in your joints as well? In your
No,
feet?
doctor, there's no joint pain. No
Okay.
joint
Okay,
pain.
that's great. Okay, so so for Mrs. Aslam, what I've understood, I mean, from your history is that you have swelling for last 2 months in your feet, and you're suffering from hypertension, and you're taking losartan 50 milligram and amlodipine 10 milligram once daily for that, and your blood pressure is under control. Under control. Is it all you want to say?
Yes, doctor. Yes, but
Okay.
I'm really worried about my swelling.
Okay. And can you tell me like how much this has affected your daily life?
Doctor, it's not affecting my daily life, but you know, my one of my uncles, he had, in fact, my paternal uncle, he had kidney failure and he died
Okay.
of it. So, you know, he also started developing swelling first and then he was diagnosed. So I'm really worried.
Okay, I'm so sorry to hear that. Let me do a bit of examination and then investigation, and I will let you know like, what you're suffering from exactly. Okay, so in order to reach my diagnosis, I need to have your examination. Is it okay with you?
Uh, Doctor, but they said that you're not going to examine me.
Okay, okay. Sorry for that. I just okay, that's great. Okay, so Mrs. Aslam, so in order to reach my diagnosis, so I need to have a few of tests. I mean, if you allow me.
Okay, doctor, what test would you order?
Okay, so I really need, I mean, some of your renal function test check.
So, doctor,
will
you
need a
really
group of.
think I have a kidney problem?
Well, like you are suffering from hypertension. I mean, for last many years. So this is one of the complication of hypertension. Your kidneys, they may get affected. So
Oh my God,
we are not
doctor,
very sure.
that's
Mhm.
so, I'm so worried.
Don't worry. So we are not. I mean, we are just asking for the test, and we are doing it on, I mean, regular basis, even just to keep the health of, just to know about the health of your kidneys and your heart and stuff like that. I hope
Okay, doctor.
everything will be fine with you.
So, doctor, how is this swelling going to go then? What would
Yes, yes, yes. Let me have the details of the test, and I'll tell you about that. Okay.
Okay, doctor. So,
So, okay, so I need to have this your renal function test, and maybe we are doing a test of your urine spot sample for albumin creatinine ratio. Mm, so we may know about your recent lipid profiles and your urine complete examination for proteinuria. Is it okay with you?
okay, doctor.
Okay. So, okay, do you need to interpret your results to me? I mean,
Mm,
the results of investigation. So I'm supposed
So,
that they
doctor,
will
I
tell me
don't
the
have
result.
any. You just
Okay.
told me to get the test
o-
done.
Okay. Okay. So, well, so far what I've understood from your illness is that, I mean, you're taking two medicines for your hypertension. One is losartan and the other one is amlodipine. So, what I understand so far is that there is a side effect of this drug known as amlodipine 10 milligram. So it causes sometime edema in your legs. Okay, the swelling exactly. So have you ever heard about it?
No, doctor, but nobody told me about it that this medicine would cause, swelling.
Mm-hmm, mm-hmm. So, well, this is there is a side effect of that drug. But it only keeps, I mean, the more fluid it keeps in your, I mean, it gets into your muscular spaces. So that's why you are getting this type of issues, like due to taking this drug. So
Mhm.
maybe we will look into it, and maybe I'll modify some of your medicine and you get out of this illness. I think so.
Okay, so doctor, what about my blood pressure? Are you going to stop this medicine?
Well, I will replace this medicine with another medicine so that your symptoms also get resolved and your blood pressure also keep
What
under the
medicine
normal.
would you give, doctor?
Well, I would like to prescribe you losartan 50 milligram along with hydrochlorothiazide 12.5 milligram. And I hope that it will help you alleviate your symptoms.
Okay, doctor. So I
So
need to stop this medicine and start the other medicine which you're telling me.
2
exactly,
minutes
exactly,
left.
exactly. So, and what is the lifestyle measures you are taking, doctor? Sorry, Mrs. Aslam.
Uh, Doctor, I didn't
For
understand your
your
question.
hypertension. Okay, so I mean, your previous doctor must told you about some, I mean, good practices of your healthy lifestyle. Are you aware of that, or do I need to tell
Yes,
you
doctor,
about it?
I do walk daily for half an hour. I've
Yeah.
recently started it, but because of
Mhm.
my swelling, I had to stop it for the last two
Okay.
months.
Okay, so I hope you will get. I mean, these symptoms will get resolved. I hope so. I would suggest you to continue this 30 minutes walk daily for 5 days a week, and try to restrict low salt diet. I mean, and do have a healthy lifestyle habits. I hope this will work and this will help you well. Anything else you want to know, Mrs. Aslam, today?
No, doctor, I got your point. Okay, doctor.
Okay, so I'm prescribing you this medicine. So while taking that medicine, you may feel maybe you get a bit dizziness while getting up, or if you observe that your blood pressure is getting lower. I mean, the lower limit is your systolic one from 90. If you get less than 90 and diastolic less than 60, or if you get an uncontrolled hypertension, I mean, your blood pressure get rises. So you please come to me immediately. Okay.
Okay, doctor.
Thank you. And so I have some instructions which my receptionist will give you. It will help you, I mean, getting your disease. I mean, about it will help you tell you about more details about your disease. Is it okay with you?
Okay.
Thank you
Okay.
so much. Nice.
Time is
meeting
up. Okay, so what do you all think? Let me ask you all, how many of you would have passed this candidate? If you can just write in the chat box. So Rida says pass. Farooq bhi pass kare. Don't be generous. You're being too generous. Yes. So somebody said it was very haphazard. Who said that? All the others are very happy. But Dr. Kaval says it was very haphazard. Hina is marginally passing. Nadia is also just passing.
It was Professor Frida, I mean, so let me do my self-reflection as well.
Batao. Acha, batao, Wes.
Okay,
I think
so
you should. Yeah.
yes. Well, what I do believe is that I mean, it was out of the blue, a new case, and obviously we are getting these type of cases in the exam as well. So what I believe is that I've taken some questions about the history. I try to ask
मुझे
about
बताओ
differentials
अवैस
as well.
ऐसी क्या हिस्ट्री में चीज थी जो तुमको डायग्नोसिस तक पहुंचा सकती थी? What did you miss in the history? सबसे पहली बात तो ये कि मैं शुरू, if I start from the very beginning, जब पेशेंट ने आपको बता दिया, you know what else में कि she has this for 2 months, आपने specific question में फिर से ये सवाल क्यों किया? Because probably you didn't hear what the patient was saying.
No, I missed that one.
To the examiner, you come across as somebody who's not actively listening. समझ रहे हैं आप? तो अगर आप repeated questions कर रहे हैं ना, एक दफा आप सवाल कर चुके हैं, पेशेंट ने आपको जवाब दिया, अब आपने वही सवाल फिर से किया, इसका मतलब है आप सुन ही नहीं रहे थे पेशेंट की बात.
Actually, I had somebody just came into my room and I was, I mean, disoriented by that
That's
time.
fine,
And
that's
after
fine.
that,
But you know ऐसा होता है.
ये repetition नहीं हुई.
अब ऐसा एग्जाम में भी होता है, you know, क्योंकि वो
बिल्कुल.
आपके दिमाग में जो चीज चल रही होती है ना, वो पेशेंट आपको बता रहा होता है ना, वो आपके दिमाग की चीज वो इतनी ओवर पावरिंग होती है कि आप पेशेंट की बात नहीं सुनते हैं. सो शुरू में एक चीज आपने ये की. अच्छा, उसके बाद आपकी हिस्ट्री टेकिंग अच्छी खासी जा रही थी और आपने अचानक से सोचा कि ये हाइपरटेंशन रिलेटेड सीआरएफ है. ठीक है ना, आपने अचानक से अपना दिमाग सीआरएफ पे बना लिया और फिर आप सीआरएफ में जाते रहे. जब पेशेंट ने चैलेंज करना शुरू किया आपको कि ये मैं क्या वाकई मुझे किडनी का मसला हो गया है, तो आपने अचानक से पलटी मारी. जिस वक्त आपने पलटी मारी एम्लोडिपिन के ऊपर, उस वक्त आपने अप्रोच नहीं शो की अपनी कि पलटी क्यों मारी आपने. आप क्यों पलटे, एम्लोडिपिन पे क्यों आए, आप मुझे बताएं. क्योंकि पेशेंट आपको चैलेंज कर रहा था, इसलिए आप एम्लोडिपिन पे आ गए?
नहीं, मैं एक्चुअली ना, मेरे 2 डिफरेंशियल्स बने थे उसमें. एक तो ये था कि मे बी यू आर सफरिंग फ्रॉम सीसीएफ एंड द अदर वन इज सीकेडी. तो मेरा ये ख्याल था,
बना था. आपने एम्लोडिपिन को
वो मैंने शॉर्टनेस ऑफ ब्रेथ का पूछा, आपको वो नहीं थी. एंड एम्लोडिपिन मैंने मिस किया. वो ड्रग का मुझे पूछना चाहिए था कि मे बी आपको ये पिछले 2 माह से आप ये दवाई लेनी शुरू की है आपने. तो ये मुझे था कि मैंने ये मिस कर दिया. ठीक है,
दैट वाज द क्वेश्चन ही मिस्ड. What question did he miss was एम्लोडिपिन आपको कब से स्टार्ट हुई है? अगर जब इनको ख्याल आ गया था ना, आपको जब ख्याल आ गया था ना कि एम्लोडिपिन की वजह से हो सकता है, तब you should have gone back and you should have asked, could you tell me when did you start these medications? वहां से ना, अगर आपने वो सवाल किया होता ना, तो शायद आप पास हो जाते. मेरे हिसाब से आप फेल हो गए क्योंकि आपने अप्रोच नहीं दिखाई. आपने अचानक से डायग्नोसिस पे आए, आपने फिर डायग्नोसिस को पलटी मारी और अप्रोच शो नहीं की मुझे कि आपने क्यों पलटी मारी. मुझे पता ही नहीं चला आपने पलटी क्यों मारी. एज एन एग्जामिनर मुझे पता नहीं चला. एज अ पेशेंट तो आप छोड़ दें, लेकिन एज एन एग्जामिनर मुझे नहीं पता चला कि आपने क्यों एम्लोडिपिन पे अचानक से, क्योंकि शायद आपने कभी प्रैक्टिस किया हुआ था केस किसी के साथ, तो आपको ख्याल आ गया अरे अरे एम्लोडिपिन से भी एडिमा होता है. लेकिन अप्रोच शो करनी थी ना. जब आपको ख्याल आ गया था, आपको पूछना चाहिए था, आपने नहीं पूछा. सेकेंडली, आपने हाइपरटेंशन है पेशेंट को, वो आपने बिल्कुल डिसरिगार्ड कर दिया. शी इज ए हाइपरटेंसिव, राइट? आपको उसके आई सिम्टम्स के बारे में पूछना चाहिए था, हेडेक्स के के बारे में पूछना चाहिए था, उसकी डाइट के बारे में पूछना चाहिए था, ऑक्यूपेशन के बारे में पूछना चाहिए था, साइको सोशल हिस्ट्री लेनी चाहिए थी उसकी, चाहे आप थोड़ी सी ले लेते, लेकिन इस केस में रिक्रिएशनल ड्रग वाज नॉट इंपॉर्टेंट। आपको हाइपरटेंशन के बायो साइको सोशल मॉडल डिजीज को एक्सप्लोर करना चाहिए था, वो आपने नहीं किया। तो मेरे हिसाब से तो आपकी हिस्ट्री टेकिंग ही इतनी वीक थी कि मैं मैनेजमेंट की तो बात ही नहीं कर सकती यहाँ पर। अगर एक पोस्ट ग्रेड एग्जाम में हिस्ट्री टेकिंग में आपने गड़बड़ करी, तो फिर हिस्ट्री टेकिंग के बेसिस पे आपको एग्जामिनर पास नहीं कर सकता। हालांकि आपकी कम्युनिकेशन स्किल्स बहुत अच्छी थी, आपकी कंसल्टेशन स्किल्स आई वुड से पर्सन सेंटर्ड थी, आप पेशेंट की बात सुन रहे थे, उसको रिस्पॉन्ड कर रहे थे, आई बाय शाई टाइम वैसे नहीं कर रहे थे, आप सोच रहे थे, मुझे नजर आ रहा था कि यू आर थिंकिंग, बट यू नो इट वाज जस्ट यू लॉस्ट इट समवेयर। आपने वरीज भी बीच में पूछी कि हाउ मच इज इट अफेक्टिंग योर डेली लाइफ। अगर आप थोड़ा सा, जब उन्होंने CRF का बोला था आपको, तो मैनेजमेंट में जब आपने कंसर्न पूछा
करने की जरूरत
लेकिन
नहीं।
एड्रेस नहीं किया उसको, राइट? आपने पूछा, अब जब वो खुद ही आपसे कह रही है डॉक्टर डू आई हैव अ किडनी डिजीज, फिर आपने कहना शुरू किया कि नो आई डोंट वरी अबाउट इट। लेकिन आपको कहना चाहिए था ये बात कि सी आई डोंट थिंक यू हैव अ किडनी डिजीज, आई थिंक दैट दिस मेडिसिन मे बी अ प्रॉब्लम बिकॉज यू स्टार्टेड इट 2 months बैक। अगर आप सिर्फ ये सवाल कर लेते ना कब शुरू किए, मैं आपसे कहती डॉक्टर आई स्टार्टेड दिस मेडिसिन 2 months बैक, तो आप उससे रिलेट करके पेशेंट को की एंजाइटी को एलिविएट कर देते। लेकिन अप्रोच का प्रॉब्लम था। तो इस तरह से मार्किंग होती है, ठीक है? कम्युनिकेशन स्किल्स I would say were good. History
okay,
taking,
ma'am. There is one or two questions. Yes. Okay. So, okay. Please, you complete it first. Then I have one or two questions, and
okay.
I need to.
So history taking में कुछ चीजें आपकी जो है ना urinary output के बारे में, if you're thinking of a renal disease, please mute करिए सब लोग. So, oh hello, who's this? ठीक. So, इसमें जो है वो आपने रेड फ्लैग्स, चेस्ट पेन, एक्सर्शनल शॉर्टनेस ऑफ ब्रेथ आपने पूछा, हेडेक्स वगैरह नहीं पूछे आपने, यूरिनरी कंप्लेंट्स नहीं पूछी, वेट पूछा था आपने, पास हिस्ट्री के बारे में भी पूछा, फैमिली हिस्ट्री आपने नहीं ली, ऑक्यूपेशन नहीं पूछा, आई वुड से साइको सोशल इसमें बहुत ज्यादा जरूरत में भी नहीं थी, बट एक आध चीज पूछ लेते, क्या करती हैं, कम से कम ऑक्यूपेशन ही पूछ लेते, कुछ तो पूछ लेते, ठीक है? अब शी वॉज अ फीमेल and a 50-year-old female, you might have asked if she's menopausal, right? Because hypertensive hai, menopause hua hua hai, you know, pedal edema, again, you know, CRF and ischemic heart disease, और ये सारी चीजें menopause के बाद ज्यादा होती हैं. तो डॉक्टर फारूक पूछ रहे हैं कि अगर if somebody has already CRF in their mind and you know they now want to come back to amlodipine related pedal edema, तो किस तरह करें? So simple, go back to the history, you know, जहां आपको लग रहा है आपने गड़बड़ कर दी है, go back, just like you do with a patient, you know, in between you realize I'm not able to get the diagnosis, you go back, right? You again start asking, when did you start this medicine? That would have made the difference. The examiner would have realized that it's okay, you messed it up, but you realized, you went back, you had